We are on. I think the show's on. We are back. Episode 3. Oh, gee, congratulations. We're still on air.
We made it.
Episode 3 of OSP TV. Welcome back to all of our great viewers. Thank you very much for your support as we start rolling out this new podcast that we've been talking about and planning. Boy, since 2019, we've been talking about these. We've got a great guest speaker today. But the overview, of course, of OSP TV is to be a resource for so many topics that are ongoing during the world and during this this crazy time that we live in. And today is going to be a hot one. But before we get started, let's introduce our panel. Of course, our co-host, the OG, that's W-U-D-Z for all you rookies out there, OG Woods. Welcome back, sir.
What's up, brother?
I'm good, Matt. You're the looks of the show, I think.
That's correct. We got the hair on this side. We got you on the other side.
Well, since we're going to start that way, to respect our guest, I'm going to refrain from rebuttaling now. This is going to be a little bit different than most of the shows that we do. Man, that Tommy Hearns show was something, wasn't it?
It's the man.
That was a great show.
Living legend.
Yeah, that was a great one. Our guest speaker today and our guest appearance, very, very hot topic going on now, of course, with COVID, the vaccines, and so many other things wrapped around it. So we brought in an expert in the field, none other than the Chief Medical Officer for Vibra Health Labs. He is one of the most distinguished physicians or reputable personalities in his field. Very happy to have him. Under the OSP umbrella, of course, one of the divisions with one source provider is OSP Health, and he is one of the partners there, also Chief Medical Officer. So welcome, Dr. Belal Abdallah.
Thank you. I'm happy to be here.
Thank you, brother. So to get started, I mean, we should probably talk about the obvious. We've got 2 Abdallahs and a Woods on the call, so on the show. So it seems like you are the minority for the first time in our history. We've got a minority. Woods, what is that? Is that like Turkish or something?
I don't know. That's a
you don't really don't know.
I think Belgium.
Really?
Or Austria. I think if I
You
go with.
think you're either from Belgium or Austria. Or,
I remember my mom saying that a long, long time ago. I don't know. I could be way off here though.
wow. Well, either way, the diversity is a beautiful thing. Let's talk about this topic that's ongoing every time you turn on the TV. Was it mid-March where this thing hit?
Yep.
Yeah, mid-March, where we were out and visiting one of our OSP offices, actually 2 of them, Houston and Dallas, and it just all started coming down. Mind you, when the news first started coming out about coronavirus and COVID, everybody thought it was a joke.
Right. I remember you texted me at like 2 a.m. and was like, we got to get out of here tomorrow.
And then in March, it all started coming down, and things were shutting down. The NBA shut down, Major League Baseball shut down, and worst of all, Tom Hanks got COVID.
That is
Terrifying.
That's when I think people really were like,
That's when I freaked out.
Celebrities are getting this?
Yeah. So we'll lead that little bit of an intro into what today's show is. Dr. Belal, thank you again for coming on, making time to be on the show. Give us a little bit of information and background about you first before we jump into this COVID craziness.
Sure. So my background is in primary care. My education is in internal medicine.
Okay.
I've been practicing medicine for over 25 years here in Airborne, Michigan.
Nice.
Joined Vibra Healthcare back in 2010, and then the formation of the outpatient Vibra Health Lab in 2016. Joined the team here with OSP Health to manage Vibra Health Lab.
Was that 2016 the inception?
That's when the inception started, yeah.
No kidding.
Time flies.
Isn't that something? I thought we were just talking about this last year. And now, full-fledged lab based in Troy, Michigan.
That's correct. We've become now a full medical lab where we provide services for not only molecular testing, but also all blood testing and all clinical aspects of
phenomenal
healthcare.
So, and I remember initially before the COVID, what was the direction for the lab prior to COVID? Because as soon as COVID hit, there was a huge pivot that had to take place so that we can, you could satisfy that pandemic.
Absolutely. So when we started the lab, we were mainly focused on drug testing, urine testing, confirmation of drug testing, but also we focused also, but we were thinking that it would take a couple of years, was to do molecular testing, PCR testing. back then, not many people knew what PCR stood for, but now I think many people do.
Sure.
So we prepared for PCR testing, and to talk about the coronavirus. In 2019, late 2019 was when it started in China, as everyone knows now. We were preparing ourselves to start PCR testing for infections. We thought that was going to be our focus. Mm-hmm. But then at the lab, we started looking at, hey, there's something going on in China and it looks serious.
Wow. When was that? What was the time frame?
This was right in December, January.
Wow. Right when I was making fun of it. I said, who made up this thing?
Yeah, many people did. You know, and no one thought it would come here. And we were also hesitant. But then I started reading more and more about it, and it looked like this was the real deal.
Wow.
That we really had to watch out.
So, Doc, sorry to interrupt you. So what made you, in your profession, in your, all of your experience, what stuck out to you where you said this thing is going to be the real deal?
So I was looking at the reports coming out of China of the way the virus was spreading in Wuhan, where it started.
Sure.
And people were getting sick, and there was no treatment, and people were dying within back when there was no treatment. I mean, they were dying within days. And so, we thought, okay, well, this could be like Ebola. Remember Ebola, maybe a decade ago, that it would just spread, and stop spreading, but it just continued. And so, to me, that was kind of like it was. The bells were ringing. This is not something that's just going to stop. So right around that time, December, January, I talked to our molecular geneticist, who we had hired just maybe 3 months prior to start our molecular testing. And I asked her, I said, we should probably look into testing for this COVID. There's nothing out there right now. There was no testing back then. But let's start looking into so that we get prepared.
Sure.
And she had the same response to me that I thought in the beginning. She goes, well, it could be Ebola, it'll come, it'll go. But then, we kept reading, and, a few days later, we're like, no, we need to really find out what's going on. We need to learn how to test for this thing.
Wow, that's crazy. So this thing, well, man, let's just jump into it. That's what we're here to do. Yep. Did this thing really start in China?
It really did, yep.
Okay, go ahead, OG. You're going to ask my next question.
Because you see the reports starting to pop up more and more now that there were, I believe, 3 researchers from the Wuhan lab, got so sick and late, November, they ended up in the hospital. So now it seems like it's gaining traction again. Was it man-made and came from that lab, or is this a natural-born virus, in your opinion?
Yeah, so, and I've read those same reports. And this is why, the president now has put a committee together.
He stopped it.
Oh, it stopped again? So
yeah,
I'm not
he
even
stopped
aware
it.
that they stopped it. But they were going to look into, was it started in the lab, or did it
Trump started that.
Yes.
So Trump started the lab, the committee to investigate what happened in the Wuhan lab. Biden just stopped that.
Yeah,
defunded it. So the question is, okay, let's go back. Because Dustin and I, we have road trips, and this is all we debate. Actually, we fight about it. We pull over to the side of the road, and we have beefs, which is why I have a little bit of
verbal fights.
Yeah, right.
We, I ain't barking up that tree.
So it did originate in China.
That's definitely true. Yes.
Okay, definitely true.
Yeah.
Now the next question. And I know you don't have any solid, concrete knowledge unless you want to share something today that this thing will go viral on. Did it start in a lab, or did some guy eat a bat and that virus spread there?
Well, that's
or rodent or whatever.
And I don't know about this defunding of the initial investigation.
I thought that's what I read.
Lab,
yeah,
but I know that the intelligence community.
Johnny, fact check it for me.
Yes, maybe we can do that.
Biden defunding Wuhan lab.
But in the last few days, I thought they were going to start. He said I'm giving you 90 days to give me a report to see where this originated from. Was it naturally from the market there where the bat, somebody ate a bat and it mixed with something else, or did it originate in the lab?
Right.
And some of those workers, like you were saying, got ill and then it started to spread from there. So I believe there's still an investigation that's started. Wow. That's different than the one that you're mentioning. That was
okay.
Yeah. So hopefully we'll get that answer.
Okay, Doc, let me ask you this. Why in God's name would you create a virus like this?
Yeah, interesting. So sometimes, scientists create viruses or put things together in order to create treatments, and maybe they're treating something else, coming up with a way to treat another virus, and so they'll start mixing different genetic material of different viruses together. It doesn't.
That's a tough sell, man.
Yeah, I know. There's some other things that I don't want to even mention.
Okay, all right. So, and me as I have zero medical experience, schooling, education. I'm talking as the average Joe, or the average Abdallah. It just doesn't make. And there's so many unanswered questions. And I'm not a conspiracy theory guy by any means. And again, we've talked about it. Why would this thing? And then, okay, let's say it was created. How did it leak? And probably to piggyback on that is, did China really contain this thing and really not let the world know how bad it really was?
Yeah, those are some intelligence questions you're asking me. But I can tell you, it probably leaked if one of the employees of that lab got sick from it, and then went outside and then got somebody else sick, and then we know now how it spreads. So
right.
It just takes a couple from the lab to come out.
So I caught COVID June 2020, June 25th to be precise. I was at a gym, and one of the members there had caught it. I had not touched him. I must have touched something that he touched, because when the Nevada, I live in Las Vegas, when the Nevada health department called me, I said, yeah. And up until that point, and mind you, they didn't get to me until 8 weeks after I had it. They were so backed up with cases. And what they do is they would call you and say, who have you been in contact with, so that we can call them and have them quarantined. I said, brother, by the time you got to me, everybody that I talked to and they talked to has already gone through the 2 weeks. But when we were talking, he said to me, there's no way you caught it in the air. This thing is not airborne. I said, that's impossible. I said, they disinfect everything, and I didn't touch anybody. I mean, everybody was socially distanced, and I probably went back to the gym a little bit too early, but it was a private training studio, and he said, no, you can't catch it airborne. So can you?
Actually, that's the main way you catch it is airborne. So our knowledge now is completely different than what was out there.
I mean, it wasn't bad. It was just the Nevada Health Department that called. Nobody accredited.
It's very difficult to catch it off of like a surface.
That's correct.
Right? Like, that's why I always laugh at people when I'm on the planes and they're like wiping everything down. And I'm like, what are you doing?
I do that.
I know. I laugh at you.
It's still good practice to do that anyway.
Thank you, Doc. Appreciate that.
But the after now that we really know exactly how it does get spread, the main way is an air droplet in the air. When somebody coughs or sneezes or breathes. Of course that
was. And I was sitting under the fan, so I'm sure somebody coughed, the air caught it, recirculated it right to me, and now it's done. But he said it's impossible to catch it airborne. And I had read that 6, 8 feet, 8 feet, then it said 12 feet that you can catch this thing. But he said no. And then he said something very interesting. And he was a great gentleman. We had close to a half hour, 45-minute conversation. He said, this is the most intelligent manufactured virus we've ever seen. And that word manufactured just stood out to me. I said, wait, so it didn't come from a bat eating or a reptile eating person? He goes, no, man. He goes, this thing is too smart. The way that it attaches to everybody's body, and it attaches different people different ways and different strains of it. And so the question is it man-made?
Yeah, that I really can't answer that right now. Just from a month ago, I would say that's more of a real theory that may be true than I could have said a month ago. But until this intelligence report comes out, we really can't say. They are going to go and investigate. What Trump stopped or whether it was stopped or not, but they're going to try to find out.
That's important. I'll tell you why. Because you're getting a chunk load of money from China, and that was going to really damper the relations. Man, this politics. Unbelievable. Well, we don't want to talk about politics. There's 3 things, Doc, we don't talk about on this show. It's politics, it's religion, and Floyd Mayweather. We refuse to talk about those 3 things. But okay. So in your estimation, can I ask what your opinion is, or would you rather not give an opinion?
If whether it was man-made or not. Again, if you asked me a month ago, I would say never. But now that I'm seeing and hearing from, like Dr. Fauci the other day now is leaning towards it was man-made. So
man-made, manufactured.
Correct.
What? Which means, what do you think, OG?
What's man-made?
I'm with you, brother.
I remember when you told me that, but also now look at, here we are, over a year later, and it's mutated.
Yeah.
There's different strands,
You got the Brazilian thing, the UK variant,
right.
the Brazilian variant. And the ones that are saying they're more deadly, they're more contagious, they're less deadly.
Well, and riddle me this. Why did China go out of its way to keep the outside world from knowing about it? And they still do to this day.
That's what I'm saying is, did those numbers really, because I'll tell you, my financial advisor said, he goes, man, in December, I got the flu for like 9 days. I went to the hospital. Nobody knew what it was. So this thing could have really leaked in November, October. Well, and then they finally in February, March, once it hit stateside, said, oh, yeah, by the way, we've got a problem.
Yeah, and I remember reading somewhere that I think Michigan was probably, specifically Detroit, one of the first hit cities in the U.S. because there's so many direct flights from China, and specifically there's direct flights from Detroit to Wuhan because of the auto industry.
I never heard of Wuhan before this. I thought the first case was in Seattle, but regardless, it started with one case. Look at how crazy that is. One case. What are we up to? How many deaths in this country so far?
Through today, almost 600,000.
My God. I lost my father last month to COVID.
Oh, I'm sorry.
Yeah, thank you. He's caught the flu before. He's caught the cold before. He's had pneumonia before, bronchitis. But once COVID hit him, it spread to all of his organs, and it was just multiple organ failure, and they just couldn't they couldn't stop it. So I'm a believer, and I know there's a lot of conspiracy about it's political, it's made up. It's not made up. It's I'm telling you firsthand, which takes us to the next topic, which is, what do you do? Do you vaccinate or do you not vaccinate? From a personal perspective, prior to my father, rest his soul, I was really on the fence. I didn't know. I said, man, I had it. By the way, I got 3 antibody tests. The first one showed I had heavy antibodies. The second one showed I had no, mind you, these are about 3 months apart. So my no antibodies, which I'm convinced it was switched with his. Because, Doc, let me tell you what happened.
Hey, it was at the Doc's labs. You don't really care what's there.
Yeah. Same lab, all three results?
No. So him and I tested together.
He was sick as a dog. Okay. And then we went to the lab.
Right. We went to the lab.
And it was positive.
Okay. So I already had, this is after COVID. So this is about 3 months after COVID. Because I started traveling, I think, in September again, 3 months after I had COVID.
It was in September,
yeah. So we went to the lab, Dustin and I, OG and I, and I said, man, I've got to still have antibodies. 3 months later. I tested in Vegas a month later, and they said, yeah, you've got, it's skyrocketed. So I tested 2 months later, which is a total of 3 afterwards, in Vibra with Dustin. Mine came back 0 antibodies, and his came back through the roof. And I go, Dustin, that's impossible. They had to have switched it somehow or put my name on yours, your name, maybe the young girl.
You did have some. It just was compared to, the amount in my body.
So now I tested again almost, what are we in now? We're in June. We're in June. So I tested in April, and I still had antibodies. So going back, I don't know if you can lose them, get them, lose them, get them.
Did you get the vaccine or no?
Okay, so before that test, the answer was no.
Before the second test?
Before all the tests. All the tests, I did not have the vaccine. And up until April, I was unsure about whether or not I wanted to get it. So after my father passed, I said, my whole family is getting vaccinated. And my father, rest his soul, a month before he contracted COVID, was offered the shot. And he said, I refuse to get it. He goes, it's not safe. I don't want to get it. But, on his deathbed, he said, am I allowed to get this now? And it was just too late at that point.
Oh, boy.
Yeah, no. Yeah. So that was enough of a, to push me over the edge and say, listen, and I made sure my whole family got vaccinated. And I'm a big fan of vaccination because I've seen the other end of it. I would much rather suffer some of the side or be subject to that very minimal the repercussions of the vaccine than what we went through. So I got vaccinated. Pfizer, 2 shots, done. What's your opinion?
Yeah, no, my opinion is everyone should get vaccinated. We actually have, I want to say, I don't want to say we're completely out of the woods yet, but we have definitely defeated this virus with the vaccine.
Wow.
Yeah. Because, right now, as of today, I think about, let me give you the exact number, 165 million Americans have been vaccinated in the United States.
That's just over half, just under half.
Just under half, yeah, about 50%. And actually 37% have gotten both doses. And the people that have been vaccinated now can go into a room with other people without wearing masks, and the chances of them actually getting infected is very minimal. So it's working.
Wow.
The vaccines are vaccines have been around for many years, decades, but this is the fastest that we've ever developed a vaccine in this country or in the world. That's because we put all our resources into making a vaccine.
Sure.
I give credit to President Trump. He said, I'm going to put all the resources into getting a vaccine, and I want it done in warp speed. And that's what the pharmaceutical companies went out and they had all the money to do it, and they did it. Many people
and they worked together.
They worked together to come up with different types of vaccines.
Sure.
But we have found a way to defeat this pandemic.
Unbelievable.
And I can say probably if the rates of vaccinations continue as they are now today, by July or August, the United States will be out of the woods. So
wow,
it's great news.
At the end of the tunnel.
There is.
That's amazing.
Is there any vaccine you see more effective or that you would recommend?
So I can give you a little the different vaccines that we have available in the United States. So we have 3 vaccines. 2 of them are mRNA vaccines, which stands for messenger RNA, made by Pfizer and Moderna. People know them by Pfizer and Moderna. Those vaccines, after the second dose, they're about 95% effective from getting infected. But even if you do get infected after vaccinations, it'll be very minimal symptoms that most people won't even feel the symptoms.
But you could still carry and expose others to it.
Very minimal. That's much less than if somebody actually contracts the virus without the vaccine, because your body fights it right away, and there'll be a lot of the ways people infect others is by how much virus they have in their body. And if you haven't had the vaccine, it's going to be able to build really quick in your body. And then if you cough, there's like millions of particles in the air, and somebody else breathes that in, and they catch the infection. But if you have the vaccine, it's minimal. It's not able to multiply like it would in somebody that's not vaccinated. And so they're less likely to spread it to others. So it's safe both ways. It protects yourself and it protects others.
Sure.
So we have 3 vaccines. The 2 of them are mRNA. The third one, Johnson & Johnson, is called a vector vaccine.
That's the one shot.
That's the one shot. That's where, and you asked me the question about why would they make a man-made virus. Well, this one was made by a man-made. So what they did, they took a similar virus called adenovirus, which is another virus that can cause a cold, just like the normal typical coronavirus before this one causes a cold. So they took an adenovirus and they made a weak one. They created a weak one. And when they inject that into the body, that gives you the immune response, just like any other vaccine. You don't need to do it twice, so one time is enough. It's maybe a little less effective than the Moderna and Pfizer, but it's still protecting people just like.
So Moderna and Pfizer don't actually inject you with the virus.
Yeah, none of them do. Not even Johnson & Johnson. No, it's a different virus.
But it is a virus.
It is a virus.
Okay, so let's forget about COVID.
Let's call it a virus.
Virus-like. Yeah. So Moderna, Pfizer do not inject you with either of those.
No, they're giving you genetic material.
Gotcha. To combat that can detect it and fight it.
Let me. So those 2, the genetic material is similar to what's on the COVID virus. It's
Okay.
similar. When it goes into your body, it tells your body to create a protein that looks like the virus,
My God.
and then your body responds to that. So
And Johnson & Johnson actually, a virus, a similar like virus.
similar like virus called a vector, and then it goes in, and then your immune system will create proteins called antibodies. Which
Okay.
will fight it.
Let's talk about the recent news. So Johnson & Johnson had a few females, I think 6 females, have blood clots.
Correct.
So would you deem that unsafe or less safe than the other 2?
No, I wouldn't. So the CDC stopped the use of Johnson & Johnson back in mid-April for a little while until they reviewed all the cases. And the side effect of blood clots was so low. I think it was those 6 women out of 3 million.
Sure.
So it was a very rare side effect that they deemed it safe. You can get side effects from any
Sure.
vaccine. As our colleague here got inflamed lymph nodes after the second dose of Pfizer, but he was the first one that I heard of. So rare side effects, as long as they're not deadly. The virus
Johnny,
is
you
still
got
deadly.
lymph nodes?
Yeah, right under my left armpit.
Seriously?
Yeah.
From the vaccine?
Yeah, I got a picture.
No, I don't want to see the picture.
Oh, okay.
Which one did you take?
Pfizer.
Really? I had 0. I thought that was the predominant one.
Brittany's friend got his face got like stuck in a little different position after he got the vaccine.
What?
What's it called?
Bell's palsy.
Bell's palsy. Yeah. Like days after.
How is he now?
I don't know. I'll see him next weekend, but he's a politician.
Wow.
God.
That usually resolves in like 3 or 4
Oh,
months.
it does?
Yeah, yeah.
Okay.
Oh,
I'll
so
let
he's
him
good.
know. Yeah, this was happened when we were in Mexico, so it was about a month ago.
That's a little scary. Look, here's the thing, right? Now, here's the thing. You can either subject yourself to the less than 0.01%,
Right.
of the side effects, or on the flip side, suffer what my family suffered and you have, a loved one pass away.
100%. Just like he said, I think, people that push that narrative don't say that it's temporary,
Sure.
They like
Sure.
make
Yeah,
it a
they
bigger
scare the
deal
crap
than it
out of you.
is. Right.
And then you've got, okay, so in your estimation, Doc, vaccinate.
Oh yeah, absolutely. Like I said, we're almost out of the woods here. And if you're around vaccinated people, like the gym that I go to, everyone's pretty much vaccinated. Everyone has their masks off.
Wow, it's
Everyone's
like back to
behaving
normal.
normally. Yeah, and that could be throughout the country. This weekend is going to tell a lot because it's Memorial Weekend and people are going to be traveling and going back and forth.
Actually, this is not Memorial Weekend, Doc.
I'm sorry, Lee.
Yeah, we're...
Oh, it is Memorial.
no, because we're filming 3 weeks ahead.
You had me for a second.
It was a couple of weeks ago.
He's
Memorial
like, wait
Weekend.
a minute.
Memorial Weekend was last week.
So we can yeah. Let me explain. They're called we call them variants or
Sure.
mutations. Vaccines will, and I want to say that because people always think that vaccines will cause more variants. It's actually the other way. The more people that get vaccinated, the less variants that will occur, because variants will only come out when the virus is spreading and it's going from body to body to body. Well, it starts to, and everybody has immunity. They have their own natural immunity.
Sure.
And so the virus starts to recreate itself because it wants to get stronger and try to survive as much as it
Sure.
can. So it'll create a mutation in its structure
My God.
when it's spreading. Now, if you stop the spreading by vaccinating, then it's less likely to mutate.
Okay. And if this was not a man-made virus, does the flu do that?
The flu does, yeah.
Okay, so this is not abnormal to see in a virus.
Oh yeah, all viruses will mutate.
Okay.
Yeah, all viruses do. And if they when they spread, so like let's take the cold for example, cold virus. And coronavirus is a cold virus. That's what it was.
Sure.
And adenovirus and others. So yeah, they can, and the flu virus. So because we're not stopping the spread of the cold, they can mutate and continue to cause infections. Bacteria mutates, they build
Sure.
resistance genes to antibiotics. So it's natural for these organisms to mutate. But if you stop the spread,
It eliminates the
it eliminates
mutation.
the mutations. Yeah.
OG, did you vaccinate?
So I'm the minority on the show again. I
Wow.
have not. But what I will make a commitment on the show that by episode 5,
All right.
we'll have one shot down at minimum.
Yeah. Good for you.
Yep.
And you should have your Brittany also do the
She's
same.
done. She already
got
She
both
got
of them.
her second one last week. It was a little rough for her, but
Was she a little tired, exhausted?
yeah. So she got it last week, and I mean, to be honest, like you said, we're almost out of the woods, and I'm not the type that really likes wearing a mask. So,
Doc, do you think that they're going to start carding people as to? I know for travel it's going to be. I mean, they already announced that they would, but do you think for restaurants, gyms, they'd start carding? And is it morally acceptable or ethically acceptable to say you can only enter the gym if you're carded or vaccinated, rather?
Yeah, I don't think they're going to go that far. I think
Okay.
There are some people who may have some contraindication to getting the vaccine, and so if you start carding people and saying you have to show us a card that shows you've been vaccinated, and let's say they had a medical condition that prevented them, then you're really violating their medical privacy.
Okay.
So this is why.
Given all of your credentials, given all of your experience, given all of your knowledge, I'm going to rattle off 3 questions, yes or no questions.
Okay.
And this is going to answer maybe 4 questions. They're going to answer all of our questions. 1, was this a man-made virus?
50-50.
Oh, man, we wanted a yes or no. Okay, let's go to number 2. Is this 5G related?
No.
3, is Bill Gates trying to take over the world with this vaccination?
No.
4, is there a tracking chip in these vaccines?
No, not at all.
You heard it from Dr. Belal Abdallah. Those are the most well-asked questions amongst the average Joes like myself. OG, you want to say something?
yeah, you're starting to see some creative, cool ideas on how they're I guess increasing the rate of vaccines. Like watch golf, and at the Memorial Tournament in Columbus, Ohio, they're going to offer vaccinations at the tournament.
Wow.
A lot of sporting events now, you see there's different sections. If you can prove a vaccination, you don't have to wear a mask, and they can pack that section full. Which I think that's kind of the midway point of what you were saying. Are they going to make it mandatory for certain things? But it seems like we'll get to a point where it's like, oh, maybe the front of the plane, if you're vaccinated,
But it's
you
the
don't
same
have to wear a
air.
mask. And then look what Ohio did. Ohio's given away, I want to say $1 million to 5 individuals. It's a lottery. They're running every week to people that have vaccinations. So one
Stop
person
it.
every week is going to win $1 million.
Seriously?
For 5 weeks.
Yep.
And they're doing the same if you're below the age of like 21 or something, you get a full ride scholarship.
Yeah, I think everyone's starting to understand that this is the only way we're gonna get out of
Right.
this, is everyone to get vaccinated, as many people as we can.
Is it
Yeah.
safe for under 18 to get vaccinated?
Yeah, it's safe. Right now, they've done studies all the way down to 12. So 12
Wow.
and over can get vaccinated
And
safely.
is it safe to say, and I know there's not any real, and I wouldn't hold you to this, but is it more than likely that anybody under the age of 12, their body can combat this and fight it on their own?
No, they are just as children under 12 will get infected. They'll be less likely to get severely ill, like adults do, or some adults, not all adults. So that's why they're doing studies now to vaccinate the children also under 12.
Wow.
So I would say in the next few months we may have a vaccine that would
But the mortality rate for children versus adults is
much
vastly,
lower.
yeah,
Oh yeah.
vastly
Yeah,
different.
Yeah.
Remember, my sister, her husband tested positive the day before she went into labor. She tested positive, and then the newborn tested positive.
Newborn tested positive?
Yeah.
Yeah.
And she was born a couple weeks early, considerably early. God forbid they all.
Is there any correlation there between the COVID and premature labor?
I don't.
There is actually. I
Oh,
mean, I don't know if in
really?
her case, but there is.
Interesting.
So pregnant women can get just as likely as any other adult, catch the infection. But when pregnant women catch it, they can get sicker, and more of them end up in the hospital and in preterm labor also. So,
and it was just just like I think a lot of people went through. It was scary because he had to quarantine at home. She couldn't have any family there. So the whole thing, like, and I think that's minor compared to what a lot of people have had to go through. With this thing. So I think it just adds to the point even more so. Like, why would you not vaccinate?
Yeah, pregnant women should also get vaccinated, even though they don't have official studies on them. But pregnant women have been getting the vaccine, and they've been doing okay with it. So I recommend that pregnant women get the vaccine, because if they catch the infection, like preterm labor is one result.
So I reflect back, and God willing, we are, as you say, close to out of the woods, if not out of the woods. And kudos to everybody that got vaccinated out there, and it's preventing anybody else getting it. So you have these outbreaks in Brazil, in India. India's just going crazy out there. I mean, they don't know what to do with the bodies anymore. Yeah. Is there any chance of that spreading even more than what it is, or is it going to be morally contained in those regions?
It comes down to vaccinations. Right now, India is manufacturing all their, they're putting all their manufacturing plants into making vaccines.
Wow.
They were exporting vaccines before they got into the surge. So now they don't allow anyone to export from India. They want all their population to get vaccinated. Regardless of what happens there, and I, we definitely want it to stop there, but the United States now is getting to the point to where no matter what happens around the world, we're protected here because everyone's getting vaccinated.
Sure. And that's the importance of it. OG, we're going to make the schedule and we're going to book you.
Done.
My guy.
I'm glad you're going to do it.
Boom.
That's it. Done deal. Well, there's so many questions out there, and sometimes I reflect back, and as we're wrapping up the show here, we're sitting in June of 2021. And you think about where we were 1 year ago today. I mean, it's just, and I always say it, and I take it with such magnitude that what a time we lived in. Do you remember how we used to look at people with masks? Like, what is wrong with you? We used to look at people like, man, are they sick? Is there something wrong with their face, their disfiguration? And that's the norm. It's the norm now to have, the term social distancing. Look how we've evolved and how we've accepted, and how in human nature and just society, the world went through a pandemic together. The world shut down. I don't know if anybody really ever just thinks about how big that is. The world shut down for 3 months. Nobody did anything. Everything stopped.
I mean, there's going to be long-term effects on how people live now. What people don't even realize it. Like, you can look at like trends like golfing is up, camping. You can barely find a campsite. Like,
yeah,
you know what I mean? Like all these things that weren't really that popular. Now people are back to doing
took
almost
for granted
old school stuff.
Yeah, we took a lot of things for granted. You're absolutely right, Dustin. My daughter, she's now 1.5 years old. So during the pandemic, when she was going through the beginning stages, for 4 months, 5 months, she wasn't around anybody but us. My other 2 daughters were very social butterflies, and they have all of our friends and family around them all the time. So my newborn, when things did start ceasing down, once they started ceasing the danger levels, and we started having people around, she was terrified. She was like, "Who are these people?" And we didn't know what it was until my wife said, she's never been around people before, and it just hit me like, holy crap. And you're right, Dustin. People, it has longer term effect. Now we can't get her away from people, but there was a period of time where she just was totally, totally neglected and cut off from the outside world, and she didn't know how to react to it. So I think that's very profound in what you said.
Well, I mean, even take here at OSP, right? We live on Zoom now. And before it'd be like, hey, let's just get, Matt on the phone, right? Yeah. Now it's like, just schedule a Zoom link in 5 seconds.
Right.
Everything's Zoom now. It's not conference calls.
That would have been a great stock to buy. Are they public?
I believe so, yeah.
Are they public?
Of course, Johnny knows.
John, of course, knows.
John, what are they trading for these days?
Well, Zoom.
One of these days, we're going to put John on camera. Actually, he should just be the voice. He should be like Inspector Gadget's Dr. Claw. Like, nobody knows who his face is.
We got to add in like a John segment.
Yeah,
Like
no, I like just the voices. Like, hey, Johnny, that's going to be our new
the
segment. Hey,
fact
Johnny.
check. That's cool.
Johnny's a fact check. Johnny fact check.
Or Johnny can give us like a Johnny's 101 for the day.
Yeah, but it's just the voice. We shouldn't show his face. Nobody should ever see his face. He should be Dr. Claw.
Telling Bean.
They'll blow the man's spot up on national TV.
He's going to edit that out.
Yeah, he's definitely going to edit it out. All right. Dr. Belal, thank you so much for joining us.
Thank you for having me.
Always a pleasure. We look forward to having you back on. Your insight and your knowledge and your experience is definitely very respected and admired. So thank you very much for sharing
Appreciate it.
that.
Thank
now,
you.
Before we go, you've got an Iron Man case. Are you an Iron Man?
No. I wish
okay.
I was.
Okay. That would have been something else to add to the accolades. OG, anything you want to add before we wrap up, brother?
No, sir. This was great. Thanks
was
for coming
great.
on.
Thank you.
Yeah. Thank you guys for tuning in. Again, myosp.com. You can go and learn a lot more about Vibra Health Labs. Dr. Belal, their whole establishment that they're doing now. Very proud to have them under the OSP Health umbrella. So, for episode 3 of OSP TV, my team, my family, my OSP, we're signing off.